Hello, welcome back to my channel, All Things Women. Today we'll be talking about the PMS and PMDD. We'll break it into two. We'll talk about the PMS first, then we'll talk about the PMDD. Now, what is PMS? PMS is premenstrual syndrome. The symptoms that most women experience before their period. Now, every woman is different. Some experience PMS while some may not. Common symptoms for PMS are mood swing, feeling very upset. Have you ever found yourself in a situation where you don't know how you feel? You could be very hot in the morning, excited, want to do things, and the next minute you're not happy. You don't just want to speak to anybody. You don't want to do anything. Or you start finding yourself being tearful. Sometimes you can find yourself being anxious and irritable. Sometimes you can be very irritable that you don't even want to listen to anybody. Anything any family member says gets to you and you react based on that. It could be symptoms of PMS that's going on. And also very tired. Sometimes you can't place it. You'll be wondering, why am I so tired? What's going on with me? Why am I so tired? And some women struggle to sleep. Are you finding yourself in a situation where you try to get some sleep and you cannot get some sleep? It could be PMS. Some women also experience tender breast. I used to experience that, but I don't know, it's changed. Maybe as I'm getting older, because I remember when I was a bit younger, in my 20s, I normally feel my breast very tender before my period arrives. There are some people as well that even whilst they are menstruating, they feel that breast tenderness. So everyone is different. Some people also experience headaches. Do you find yourself like having headaches? And you're thinking, oh, why am I having this headache now? So it could be symptoms of PMS. Some people have spotty skin. In Africa, we popularly call this pimples. Yeah, sometimes you just find yourself, having pimples in your face. And to be honest, sometimes it's not just in the face. You could find it on your back, on your shoulder. So it depends on the part of your skin where the spots starts coming out from. Other symptoms is the changes in the woman's appetite. Some women, they love eating. When they see food, they just want to eat everything. But some people, they're just not into food. And you're wondering, what's wrong with me? What's wrong with me? Why am I not eating? It could be something that you love eating before, but suddenly you see it and you're thinking, I don't want it. Please, just take it away from me, So these are the symptoms of PMS. And some women also experience changes in their sex drive. Some people are very active, their sex drive could be very, very high in this period. But some women don't want their husband, their partner near them when they're going through this period. So it depends on you. Every woman is different. And when you understand how you're feeling about it, then you'll be able to speak to your doctor about it and address it. Now, the PMDD is called the Pre-menstrual Dysphoric Disorder. People that suffer from PMDD struggle with everyday activities. Some of them, it affects them that they can't even work. They don't have a social life. They cannot keep a relationship because their moods are up and down. It's something that they cannot control. So it's severe. It's really affecting them. And the symptoms that I've outlined with PMS is similar with PMDD. The only difference is that if the person is experiencing mood swing, the mood swing is to the extreme. It's something that they cannot control. When they're having cramps, they are in pain, like serious pain, as though they are having a baby. Yes, they feel upset. Yes, they are very anxious, very irritable. All the symptoms you experience with PMS is the same symptoms that the people with PMDD experience. But theirs is severe. And when somebody starts experiencing PMDD, the person might start having suicidal thoughts. That is why the doctors, they take it very, very serious, and you are advised that once you start feeling this way, contact your doctor, contact your GP if you're in the UK. Find out what is happening to you and see where they'll be able to help. Another symptom of PMDD is what is called binge eating. This binge eating is uncontrollable eating. Like you see food, you just want to eat and eat and eat. So it's a disorder. And what are the causes of PMS and PMDD? The doctors and scholars have not been able to, pinpoint exactly what the causes of these are. But in the case of PMS, they have said it could be due to the hormonal changes during the woman's cycle. But in the case of PMDD, they also say that it could be partly hormonal changes during cycle, and it could also be the genetic variation, which means differences in the genes one could have inherited from their parents. So you find out from your parents. PMDD and PMS occurs during the luteal phase of a woman's cycle. The luteal phase is from when the woman is ovulating till the time the woman will see her next period. Please refer to my previous video where I talked about the woman's menstrual cycle and the hormones and the glands responsible for the consistency and the regular occurrence of the period every month. What are the treatment for PMS and PMDD? First and foremost, if you're having any of the symptoms, then you speak to your doctor. The doctor will first of all advise you to make some changes in your lifestyle. Example, if you're somebody who smokes, the doctor will advise you to reduce smoking or stop smoking entirely. If you're someone who drinks, they will also advise you to stop drinking, and they encourage you to have regular exercises. Studies have found that exercises does help us live better, and exercise can also improve our state of mind, our being. So doctors advise that you exercise. Doctors also advise you to watch what you eat. Make some changes in your lifestyle, in your food intake, and try out different things to see if any of these things will be able to relieve the symptoms. But if all these things you've tried them and none of this work, but the doctors might decide now to prescribe what is called antidepressant. There's another treatment they called combined oral contraceptive, often called the pill, because all this medication will interact with your hormone. Something again they call the talking therapy and counseling. So if you're having PMS or severe case of PMDD, your doctor will advise you maybe to go for counseling or the talking therapy. In some cases, they might also prescribe painkillers and anti-inflammatory drugs for you to take. So again, it depends on your case. You need to speak out so that the doctors will be able to help you. In rare cases of PMDD, the doctors might decide to give you an injection. So they give you this injection to induce the early onset of menopause. And lastly, if it's in that severe cases, the person might actually have a surgery. So it depends on you. It depends on what you're going through. It depends on what you're suffering. Oftentimes, women, when we have problems, we are ashamed to speak out. Especially in Africa, where I'm coming from. A woman could be depressed. You are ashamed. The woman is ashamed to talk about it. In Africa, people are concerned about what people will say. You're concerned about what your neighbor, what your husband, what your mother-in-law would say. Pause for once. Think about yourself. If you're feeling this way, speak to your doctor. You want to get better. You don't need to tell anyone that you're going to see a doctor. You don't need to disclose that to anyone. You could just see a doctor and get the help that you need. In our next episode, we'll be talking about contraception, different kinds of contraception out there, and how a woman can also dictate when it's her safe period and when she is not safe. So many people are watching, as I can see, but so many people are not subscribing. Please subscribe to my channel, Give your sister some love. Thank you so much. Thank